Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, pretty crazy data coming out of Miami. I'm putting out a public service announcement about the danger of having plastic surgery in Miami. You're going to want to see this one. And then after that, what is melasma? What can you do about it? We're going to tell you. And then finally, PDO, thread lifting in the face. Is it worth it? I'm going to give you my opinion on it, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann. And with me, as always, is Sarah. Hello,
Hi.
Sarah.
Hi, how are you?
And in the box, it's not Travis anymore. It's Brenna. Brenna, are you there? Hi, Brenna.
I am. Hello.
Welcome to the show. We are so excited to have you.
Thank you. I'm so excited to be here.
Yeah, we're so Brenna, are you millennial or are you a Gen Z?
Gen Z.
You're Gen Z?
Yes.
That's so exciting because now we have like the crotchety old Gen Xer,
Millennial.
the millennial, and a Gen Zer. So I feel like we're getting a very diverse kind of generational viewpoint on the amazing topics
and
that we
she's
go.
going to learn all about
She's
plastic
going to learn about
surgery.
plastic. You're going to be an expert on plastic surgery. You know that?
I'm excited.
She's going to start getting Botox.
No, she's too young for Botox. Don't listen to Sarah.
I don't know.
I won't let her fill your head with any bad ideas, I promise, Brenna. All right, well, welcome, Brenna, and please jump in whenever you want.
Will do.
All right. Hey, also, Sarah, you know, today, it's not our 3-year anniversary, but it is the 3-year anniversary of the show.
Yeah.
Can you believe that?
It's crazy.
3 years, oh my gosh. And it's been really good. We're growing. Like, I'm really excited to see where the next year goes.
We
got
are growing.
Brenna, our new Gen Z awesome producer. I'm excited about that. We have a lot of good things to be excited about.
Yeah.
Yay.
All good things.
High five. All right, let's move into some segments. Okay, so that was a really fun intro, but I have a very serious topic that we're gonna have to talk about. And honestly, I do think that this segment, which we're about to do, should go viral because this comes from actually an article that is very tragic, but the real story is in the data behind it. So this is a segment, it's a public service announcement about the dangers of having plastic surgery in Miami. And
Of course.
Yeah, of course it's Florida, right?
Yeah.
Yeah. So Brenna, we always do not always, we do segments when things go wrong in plastic surgery because we want to educate people on, you know, how they might potentially avoid a bad outcome. And of course, it's not to sensationalize these people's very sad stories. But so this comes from the story of a 26-year-old police officer from New Orleans named Wadelis Rosa, and I have a picture of her. She's actually a veteran, served overseas. She's a police officer. 26-year-old, you know, in the prime of her life. For her birthday, she wanted to treat herself, and so she decided she was going to go have plastic surgery, and she was going to get a Brazilian butt lift, which you guys know. Well, Brennan doesn't know, but Sarah, you know, I don't like those surgeries.
Yeah.
They're pretty dangerous.
Against them. I always tell people no.
Good, don't do it.
Yeah,
excellent.
do not.
That's good. That's good advice. So she went to Miami, which is a hot spot for medical tourism. You know, I don't like medical tourism either. So like this story is starting out, you know, very upsetting to me. So she went and she had the procedure, and allegedly she got liposuction from 12 different areas, which just blows my mind. That's like an insane amount. Like, you know, for me, if I do a really big liposuction case, I might do like tummy, you know, hips, and maybe one other area. So I might do like.
I was thinking like.
I don't even know where 12 areas are
areas
that you can lose fat. Like, that's like crazy, right?
Yeah.
They must have done her abdomen, hips, bra line, calves, the under, I don't know where, arms. I mean, you look at the girl.
Was it all supposed to go in her butt?
Well, right, and so that's one of the big problems with Brazilian butt lift is that you need so much volume to to make a difference that these people get over liposuctions, which also puts you at risk for complications, which is exactly what happened. So she had 12 areas liposuctioned, they injected the fat, and she was allegedly discharged after 1 hour, which sounds crazy to me. After that much surgery, people typically need a little bit more time to recover, but okay. And she allegedly started having complications, pretty quickly. She was complaining of extreme pain. She lost feeling in her feet and her legs. She was starting to have swelling. She looked pale. Her lips turned blue. Like, she went back for a follow-up, and
She was still in Florida at this time.
yes,
Yeah.
she stayed at one of those like short stay kind of places, and so she was still in Florida. She went back for follow-up, and there's no report of this place sounding the alarms of her having these complications. Of course, this is all what the family is saying and what the news article is saying, but it sounds like she was having really big issues. So she went back to her short-term stay facility, and she collapsed, and her, I think it was her friend or her sister found her, started CPR, but unfortunately they couldn't get her back.
So she was by herself when she died?
Yeah, she was by herself, yeah.
Oh my goodness.
And so she passed away very sadly, and the medical examiner said her cause of death was an embolism. Now, normally with Brazilian butt lifts, it's fat embolism. They said this one was actually a blood clot embolism, which may or may not be true. They may have confused it when they wrote the news article. It kind of does make sense, though, because fat embolisms tend to kill you pretty quickly after surgery, and apparently this happened a couple days. So it could have been just a blood clot embolism, especially after having so much liposuction. So it's a very tragic story, but the actual newsworthy, not that a death isn't newsworthy, but kind of the crazier part of this is the news outlet that was reporting this story talked to the medical examiner, and the medical examiner said in the past 3 years, or just over 3 years, there's been 25 deaths from plastic surgery in Miami-Dade County.
Goodness.
That's like an insane number, like
Yeah.
25 deaths. Like, the rate of death from plastic surgery should be insanely low. And so what I did is I actually went and looked at 2 other areas that are known for plastic surgery, Dallas-Fort Worth and Los Angeles. And I did a search both manually and using AI metrics, searching for stories about deaths from plastic surgery in the past 3 years in those 2 locations. You know how many I found? 0. I found none. No reported death. The only deaths I found were there was a lady from Dallas who traveled to Mexico and died from plastic surgery, medical tourism again. And there was a couple in Los Angeles that weren't actually like doctors. It was like somebody's garage injecting Home Depot silicone into their butt situation where they died. And so, I think this is like literally nationally newsworthy. I mean, Miami has a problem. Like, that is an insane number of deaths from plastic surgery, which should have a just extremely low death rate. And granted, Miami does do plastic surgery on a higher rate than almost every city. I think they are number 1. But when you look at the plastic surgeons per capita in Miami versus Dallas and Los Angeles, which also are 2 very big plastic surgery hotspots, they only have about 1/3 more.
Yeah.
So logic would dictate that they're doing about 1/3 more plastic surgery in Miami versus these areas per capita. But like, if the statistics were the same, that would mean that Los Angeles and Dallas would have like 16 or 18 deaths in the same time frame. And I can't find any. Like, I found 0.
Yeah.
So I think that Miami does have a real problem, and to the point that I would, I'm not like in charge of any governing boards, but I would issue like the United States issues a travel advisory, like don't go to Afghanistan because it's dangerous. Like, I would issue an advisory, do not go to Miami and have plastic surgery. I mean, the data shows that people are dying there in insane numbers.
Is it like these plastic surgery centers or companies, they're hiring like sketchy doctors?
That's an excellent point that you bring up, is why do we think that their numbers are high? And I think that you hit probably the biggest nail on the head, is that Florida has extremely lax regulation on who can do what. And so I actually, on that theme, I looked into the place where this lady, Mrs. Widelis Rosa, had her surgery. So it was called Prestige Plastic Surgery.
Okay.
I went to their website, claimed to have board-certified surgeons. So you would obviously think that these are board-certified
Like
plastic surgeons, right? Because it's prestige, literally says plastic surgery, not cosmetic surgery. And the only surgeon I could find on there was a general surgeon that was doing cosmetic surgery. They were board certified, but the board certification was for general surgery, not plastics. I mean that's borderline fraudulent to say you're a plastic surgery office and that your doctors are board certified and then not be board certified plastic surgeons.
Like, to me, that's almost like a surgeon being like, I'm a cardiac surgeon.
Yeah, right. Yeah,
no,
exactly
you're
right.
A general surgeon.
But you're exactly right
So
as far
weird.
as like, what are some of the possible reasons that Miami has this high death rate? Well, the regulation's very lax. Those plastic surgery mills, people are getting enticed to go to Florida with really, really cheap surgery, but they got to make up the cost somewhere. Well, how do they do it? They hire people that are, probably not the best. I mean, if you're not a plastic surgeon, you're going to work for less
gonna
money
take
than a
what you
plastic
can
surgeon
get.
will, right? Or if like maybe you've lost your license in 10 states and you can't work
Or you're
anywhere.
from like another country and have a
Could be.
different,
Yeah, could
like
be
maybe you're a
different training
plastic
program.
surgeon from another country
Yeah,
and you come
where
here.
where like the training's different. It's interesting. I may actually go so far as to do a search of all these plastic surgery mills and see.
Can we go undercover?
Dude, you know what is so funny? My friend last night.
Except I will not be getting surgery.
I was telling my friend about this segment, and he's like, "You should go undercover and
That'd be
ask them
so
about
funny.
like their training and their board certification." I was like,
You should.
That's brilliant." But it would be hard for me to do it. But we could send you. I could like put like one of those like little secret agent things in your ear.
Yeah, as long as I don't have to actually go through that.
No, of course not.
I know, but still, like a fun trip to Florida.
Yeah, exactly. We're going on the road. Brenna, you ready to go on the road? Nip talk on the road?
Absolutely.
Okay. We won't make you go do like the undercover stuff just yet. We'll let you get a few shows under
You'll
your
just
belt.
go to the beach.
Yeah, before we toss you out to the lions.
Perfect. I love Florida, so.
Okay, all right.
Minus plastic surgery.
Yeah, minus the plastic surgery.
Minus the BBLs.
So, and I think these places are cutting corners because they're offering surgery dirt cheap. They're doing a lot of Brazilian butt lifts, which are inherently more dangerous. I think that these places have very poor, doctor-patient relationships. I mean, why wasn't this lady who was having complications sent to the hospital when she went back for a follow-up? Like, what happened? Did the doctor even see her? I mean, who knows?
Yeah,
You
my
know?
lips are turning blue.
Yeah, if someone's
better
lips
just,
are blue,
lay
like that's a
down.
huge problem. I mean, that needs to be addressed. And so I don't know. I think that Miami has a serious problem that borders on a public health concern with patients dying from plastic surgery, and nobody is talking about this. Like, no one's talking about it. Like, how many times have we talked about patients that die when they go to Florida to have plastic surgery, and there's no one says anything? It's like, oh, another patient died. All right, what's next in the news cycle?
We need to write a letter to. Is that go under the Department of Health?
I don't know. I feel like, we just got to get the word out there. You know,
Yeah.
I mean, maybe doing shows like podcasting is the next news. So maybe doing stuff like this will get the word out. But I would not. I mean, I do think there are probably some very fine plastic surgeons in Florida.
For sure.
But you need to go to the doctor and not to All-Star Plastic Surgery Center or All-Star Cosmetic Surgery Clinic or whatever it is. Like, go to the doctor that you know is board certified, you know has had the right training, that you're having a relationship with the doctor, not some corporate mill that just runs patients in and out.
Yeah.
Like, a lot of these deaths we're seeing come from these places. Like, it's a pattern at this point. And I think that we can't ignore it any longer. So
No, that's really scary.
it is scary. All right, Brennan, I'm gonna recap this one real quick. So today we were talking about a very crazy, very sad, but I think important story that no one else is talking about. It was about the death of a young woman from New Orleans who went to Miami to get plastic surgery, medical tourism. She went to get a Brazilian butt lift for her birthday. She was a police officer, a veteran in the prime of her life, and 2 days after her surgery, she passed away from complications from her surgery. And we do segments like this all the time where we talk about these tragic outcomes, and so many of them do happen in Florida, and specifically Miami. And the crazy part is that in the article that talked about this, it said that the medical examiner in Miami-Dade County said that 25 people have died from plastic surgery in the past 3 years. That is an insanely high number. I did a search for Dallas County, Los Angeles County, and in the same time frame, I found 0 deaths in the news from plastic surgery. And I think that this is like a borderline public health crisis. Like, those numbers are insanely high. And yes, Miami does more plastic surgery than Dallas or Los Angeles, but not that much more to have an exponentially higher death rate. And we were talking about some of the possible reasons. There is a lot of corporate plastic surgery, or not even plastic surgery, corporate cosmetic surgery, where these corporations offer very cheap plastic surgery, but it's not plastic surgeons that are doing the procedures. And that certainly is probably playing a part in this. So I think this is a breaking story. I hope people will spread the word that there is a problem in Miami, and I would not recommend that you go there to have plastic surgery. So,
100%.
Bam! Sarah, jumping in. Okay, enough depressing stuff. Let's talk about less depressing stuff.
Yeah, I don't even know what that is that we're talking about.
Oh, the next one?
Yeah.
I was going to ask you if you had this. Have you ever had melasma?
No, it sounds like molasses.
It's not. It's kind of like molasses. It kind of
Is
looks
it
like
a sugar
molasses.
problem?
It is not.
Oh.
I'm surprised you don't know about this. Have you heard of melasma, Brenna? Don't let me forget Brenna's name, Sarah. I'm terrible with names.
I thought you were saying Brittany this whole time at the beginning.
I have not. I also think it sounds like molasses.
Okay,
It's like
all
where
right.
mine went.
Excellent. So I'm going to educate you too on this
Okay.
because you might not have risk for it anymore, but Brenna's going to have risk for it. Although her skin tone's a little light, so she probably doesn't. You should have risk for this. You got lucky. All right, so have you ever looked in the mirror and said, what is this brown shadow on my face that wasn't there before? Well, that could be melasma. So what is melasma? And I have to thank my wife for bringing up this topic. She suggested this one because she had melasma at one point. And so she thought it would be a good segment. And so you see on this girl, and we'll bring this picture back in a minute, but that's melasma. So melasma is brown, blotchy patches and or freckle-like spots on your face. Have you seen anybody with melasma now that you know what you're looking for?
I used to, whenever I was a little girl, I used to be outside a lot.
Okay, and you got...
I'd get white blotches on me.
That's similar, yeah. So
Instead
it's
of
white,
dark.
yeah. Okay, but that's a UV reaction as well. So it's very, very similar. They typically say melasma is always dark because it's the melanocytes, but it's a similar reaction. So okay, so you're kind of in there, kind of know what's going on. So this most commonly occurs in the cheeks, upper lip, forehead, nose, or jawline. Throw that pic, the next pic up there, Brenna. I think it's the same pic, yeah. So that's classic melasma right there on the cheeks, kind of going down to the chin. Pretty classic look of it. It almost looks like it's like you got some like base or something on, but it's not. Like it's part of your skin.
It looks like heavy freckles.
Yeah, it does. Yeah, and it can be really blotchy, or it could be more freckle-like. So it's a little bit of variation. So what causes it is not fully understood, but they do know that it is a overactivity of melanocytes. So the melanocytes are the cells in our skin which give it color.
Cool.
Right? Melanocytes. So what triggers it? You just said it.
The sun.
The sun, yes, thanks, Sarah. The sun exposure definitely triggers it. Pregnancy.
Okay.
They call it the mask of pregnancy. Have you ever heard that word, the mask of pregnancy? That's melasma, yeah. If you ever hear that word, or that term, mask of pregnancy, it's talking about melasma. So pregnancy, taking birth control pills, hormone replacement therapy, other UV exposure, so that would be like tanning beds, and then heat. Also, there's some minor link with stress and then thyroid issues, as well as genetics, meaning like if your mom has melasma, then you're more likely to have it. But the biggest links are ultraviolet light, which would be like sun or tanning beds, and hormones, which hormones covers pregnancy, birth control pills, and HRT, hormone replacement therapy. It's most common in women by far, 90%. So it's probably related to progesterone and estrogen.
Okay.
That makes a lot of sense. Most commonly in the 20s and 40s. So both of you young women are still at risk. However, it does affect darker skin types more. So have you ever talked about Fitzpatrick scale? So Fitzpatrick scale is like a scale of 1 to 6, like from the fairest Irish to the darkest black skin. And I have a little pick there, Brenna. Yeah, there we go. So types 3 and 4, which is kind of the middle. So that's like brunettes, like light brunettes to like dark brunette, natural hair tone, and corresponding skin tone have the highest risk. So meaning like there's some melanocyte activity, it's not super fair, but not like necessarily the darkest. They're the most at risk for melasma. It affects up to 6 million Americans at any one time, and about half of women get some amount of melasma during pregnancy. Now, there's no risk or association with cancer.
Okay.
Some people are like, oh, I have this splotch on my skin,
Yeah, it seems like cancer risks go down the more you're susceptible to, it looks like on that chart.
Oh, right, yes, that's skin cancer.
Yeah.
Yes, you're totally right, yes. Fair people are much more prone to skin cancer than darker tone.
But they're not as prone to the melasma.
To melasma, yeah, correct. That's
so they're like
exactly.
opposite.
They are kind of like divergent.
Yeah.
That's correct. So there's no risk or association with cancer. However, there is an association with depression, meaning if you get melasma, you're more likely to be depressed because it's like it's a aesthetic thing. You see it, and you're like, oh, I don't like that. I remember when my wife got it, she was like, oh my gosh, I have melasma.
And if it's related to hormones, if your hormones are hormones are somehow irregular,
right, then that can make you more prone to depression.
Birth control causes depression.
Yeah, absolutely.
Being pregnant causes depression sometimes.
Right, yeah, again.
So.
Yeah, absolutely. No, for real.
Yeah.
So one of the nice things about melasma, if there is any nice thing about melasma, is that if it's triggered by something like pregnancy or you started medication or you had like a really huge sun exposure, if you remove that trigger, like have your baby or change birth control or don't stay out in the sun too much, it actually will resolve on its own a lot. In fact, my wife's did. She had it and it wasn't bad, but it was like noticeable, but then it went away.
Yeah.
So that is one of the nice things. However, it doesn't always go away, and it can actually persist or be even semi-permanent. So the next question is, well, can you treat this?
Okay.
So melasma is definitely one of those things where an ounce of prevention is worth a pound of cure, meaning it's better to not get it than try to treat it after you do get it. Right. So by not get it, the biggest thing would be to protect yourself from the sun, because obviously if you have to start birth control pills or you get pregnant, you're not going to avoid that, right? You might change your birth control if you get melasma, but you're not going to avoid pregnancy. But the sun exposure, if you're prone to melasma, sunblock.
And wearing it like a hat.
Yeah, a wide-brimmed hat, yes, excellent. That's very, very good. But if you do get it, there are some treatments for it. Most people go to a dermatologist when they have melasma. We at our place, we don't do the medications, but we do have like the more procedural treatments for it. But the medications include hydroquinone, which we've talked about that from time to time. It basically inhibits melanin synthesis. It's like a skin bleacher.
Okay.
It tamps down the melanocytes, which is the cause of this. Then tretinoin and steroids together as a combo is good. And then there's the triple therapy, which is hydroquinone, tretinoin, and steroid all together.
What does tetranoin do?
That one, I can't remember exactly the mechanism of action of tretinoin. I know that hydroquinone inhibits melanin synthesis. I can't remember what tretinoin does off the top of my head. I used to know. Sorry, that's a good question. I love when you ask me a question I don't know, because now I feel like a total idiot, and I'm going to have to go look it up after we get done with this segment.
Maybe your wife is watching.
I can't remember. No, I just can't remember. It's used a lot in dermatology, and it's just not something I use very often. And then there's a triple therapy of all three.
Yeah.
But then there's also like more like non-medical or non-medicine treatments, like the more aggressive treatments. So like chemical peels. Okay. So our esthetician has been using chemical peels for melasma, and she's told me that she's had pretty good success with that.
Okay.
And then the microneedling, so like the Morpheus has been used to treat it.
Okay.
However, we've been using more the laser treatment, which is another treatment for melasma. You do have to adjust the settings of the laser a little bit. You got to be a little bit more careful, like use a little bit less heat on it. But the girls,
because that like triggers it to.
Yeah, it could actually like make it darker.
Yeah.
So you got to be careful with the laser, but the laser is a good treatment for melasma if it's one that is not kind of going away on its own.
Okay.
So yeah, it's kind of like one of those things where if it pops up on you, like you are prone to get it and you want to like avoid triggers, So like, my wife probably should not like go to a tanning bed or lay out on the beach all day without sunblock because it could trigger that back, But yeah, it's one of those things that, a lot of people get it and people can stress out about it. But if you know about it and, have some information about it, it's not something you need to be.
And it usually happens on your face, right?
Correct. Yeah. Face, cheeks, nose. Yeah. So that's why people stress about it. Yeah.
Yeah. I think that we've talked about previously, like part of your skincare routine should be putting SPF on your face.
Absolutely.
Even when you're not
the
going to a beach.
3 pillars: cleanser, moisturizer, sunblock.
Yeah.
So important.
Yeah.
Do you have a good skincare routine, Brenna?
Yes, I was gonna say I'm all for the sunblock because I'm like
you're very
super
fair.
Pale.
Yeah, you're like a Fitzpatrick too.
Yeah, so I get freckles
you're like a 3
lot.
or 4.
Like my shoulders are covered in freckles. Same with my sister. Like her face is covered in freckles.
Yeah, believe it or not,
Yeah.
2 of my sisters have your skin tone and they're red-haired and blonde.
Really?
Yeah, blue eyes.
Wow, interesting.
Yeah. I look like the adopted
Like you were adopted.
child. They used to tell me that too. I definitely wasn't, but they're like, "Oh, you're adopted. That's why you look so much different." I'd be like, "What?" My mom would be like, "Stop."
How funny. All right, let me recap this one real quick, Brennan. So today we were talking about melasma, also known as the mask of pregnancy. So melasma is basically dark, blotchy patches that can appear on the face. It happens by far most commonly in women, about 90% or greater. The reasons that it happens physiologically are not completely understood, but it's thought to be an overreaction of the melanocytes, which are the cells in our skin which produce pigment. And it is triggered by certain things. Pregnancy is a big one, why it's called the mask of pregnancy. Birth control pills, hormone replacement therapy, the sun, ultraviolet light, huge trigger. And when this pops up, women can get kind of upset about it because it affects their appearance and how they look. And there's also been some link that patients with melasma are more prone to depression. Now, there is one good thing about melasma. Typically, if it's triggered by something like a pregnancy or starting new medication or heavy sun exposure, if you reverse that trigger, it does tend to go away over time, but not always. There are some treatments for it. There's several medications like hydroquinone, tretinoin, steroids, and then combo therapies of those. And there's some procedures that can get rid of it. Chemical peels we've used in our med spa, as well as microneedling like Morpheus and the Halo laser have also been used to treat it. So yeah, melasma is something people get very upset about sometimes when it pops up because it can be very noticeable. But if you learn about it, you can find out that there are treatments for it. So all right, melasma. Molasses, excellent. We're talking about molasses. All right, I got one. I want to get you guys' opinion on this.
Perfect.
So this segment, all of these segments I do, they come when I get a consult for a patient, and this is one of those. This is one of those cases. So this is a segment about PDO thread lift. Is it worth it? So are you guys familiar with thread lifts?
I've heard of it. I think you've talked about it before.
Now it's different than threading, like the hair removal threading. Because there's some confusion. Like, isn't there a threading that's like hair removal?
I don't know.
Or no?
I think for eyebrows.
Yes.
Yes.
It's different than that.
Oh, okay.
Oh, I was like, what are you talking about? I've never done that, so I don't know.
Well, I've never done it either, but I've heard about it.
Now that you say it,
Yeah,
I see
threading.
it. I used to see it in the mall when
Dude,
it got
thanks,
really
Brittany.
popular in the mall.
Came up clutch there. Helped me out. Appreciate it.
Yeah.
You get a gold star for the day.
Thank you.
All right. So this actually comes from a call from the ER I got this week. And so I always love these calls. ER doc called and said, hey, there's this lady that went to Mexico to get some procedures done. You know how I feel about medical tourism. I don't like it.
No, sir.
Brennan, I don't like medical tourism. You're going to learn that. BBLs and medical tourism, I do not like. But went to Mexico and got PDO face threading, also known as the non-surgical facelift. And of course, everything was fine when she was there, but she gets back home and they get infected.
Gosh.
And that is a potential problem. So right now she's on antibiotics. I haven't actually seen her. They were letting her go home on antibiotics. But if that doesn't take care of it, like she may have to have these threads literally cut out of her face, which totally sucks. So I'm hoping the antibiotics clear this up. So I want to do a segment on PDO thread lifts. Have you guys heard of this? Wait.
I've heard of thread lifts.
You've heard of threading. Okay. Brenna, heard of threading?
Just eyebrow threading.
Okay, so that's the difference. So this one is totally different. All right. So what is a PDO thread lift? Well, PDO stands for polydioxanone, which is a dissolvable suture that's used in surgery. In fact, I use PDO suture. I use it for two important reasons. One, when I'm fixing the abdominal muscles in a tummy tuck.
I think I've had that whenever I had a C-section.
Oh, you did? I was like, I didn't know you had a tummy tuck.
No.
You need a C-section. Okay.
Yeah.
PDO is what I use, and people use different things, but I use PDO. It's a long-lasting dissolvable. So it lasts about 6 to 9 months, which is a lot longer than Vicryl, which is the other dissolvable suture that I use that lasts about 2 to 3 months. I like the PDO for things where I really want it to last a long time, but I don't want it to be permanent. Because PDO can last for over a year. I've opened people up that had surgery a year in the past, and I found PDO. So it's a dissolvable suture, and the way it's used for threading is they used a barbed PDO. And so I have a picture of it. Brennan, throw up that next picture, will you? Yeah, so that's a barbed suture. So you can see it's a filament line, like fishing line.
Okay.
And you can see those little hooks on it, right?
Yeah.
Okay, so the way threading works is they use a needle to push that suture into your face. And so I don't think I actually have a picture of that, but you can imagine here, Brennan, come to me on the camera here. Yeah. So like if you want to pull the face up and back, right? So they'll put these sutures into the face, and because it's barbed, it catches the tissue, and then you can pull the suture back, and it will pull the tissues.
Cool.
So it's kind of like what a facelift does in that it cinches the tissue. And so you get a kind of lift from that. And it does dissolve, but the suture being there in and of itself causes collagen formation.
Okay.
So the suture goes away in about 6 months, allegedly. But the collagen formation tightening can give you results for like a year or two.
Okay.
So, okay.
It's not permanent.
It's not permanent, no. Yeah,
Okay.
not permanent. So, okay, that doesn't sound, terrible, right? I mean, maybe that would be good. I think the results for these are okay. I don't love them. In fact, one of the more interesting things that I should point out is, although plastic surgeons absolutely could do threading, I don't know of any that do.
So is this procedure usually done by like cosmetic people?
Yeah.
And you don't have to be like put to sleep or anything?
No, you can.
Just
Yeah,
like
that's
numbing
an
stuff.
excellent question. Thank you for asking that. You do not need to be put to sleep. You can do it like in a med spa, or it can be done by like a nurse practitioner,
Okay.
or family practice doctor. So what generally the people that do these are like the non-plastic surgeon aesthetic people, because
Okay.
they don't offer the alternatives,
Okay.
right? They don't
Like
have
a real facelift.
or other more high dollar equipment,
Okay.
which we'll talk about. Yeah. So I think that that's noteworthy that plastic surgeons who, should be considered the kind of apex as far as knowing like what are good treatments and what are not, are not using threading. Like that's pretty telling to me. And I personally don't like threading because one, I think the results are just kind of okay.
Not worth it?
I personally don't think so. I mean, it can be all right, okay, so not bad, but the risk is exactly what this girl has, which is if they get infected,
Yeah.
okay? Because barbed suture sucks to try to take out. It's literally got like grappling hooks on it. And when you put it into the tissue, and then if you have to cut that out, it is a disaster.
Yeah.
Like you literally might have to cut lines into their face to get this thing
Ew.
out.
Look like they got attacked, I'm sure.
Yeah, like attacked
afterwards.
like by a tiger.
Then they have to like have some type
Yeah,
of
and then you
facial
have to
plastic
have,
surgery.
right, it's just a mess.
Gosh.
And so because of that risk, like I would never do threading. I sure, almost said a bad word, wouldn't do to go
Go to Mexico.
Yeah, I sure would. I sure AF would not go to Mexico
Yeah.
to have that procedure done because of the risk of infection.
Right.
And so I don't know what's going to happen to this lady. I hope that the antibiotics work, because if I have to cut these things out, man.
I wonder, don't you sometimes get like a steroid shot for that kind of stuff too, if it's like that bad?
Yeah, to tamp down like the inflammation, but like that ain't gonna make the infection go away.
Yeah.
So, yeah, it could be bad. So what are the alternatives, right? So if I'm not a PDO threading fan, what else could you use? Well, surgically facelift, neck lift are out there, which I actually try to trend people into non-surgical things unless they're, say, like 75. You get a lot of people coming in 50 years old wanting a facelift. I'm like, yeah, you're a little young. Why don't you try something non-surgical?
Or like my sister. Remember what my sister's thing? She wants to get a facelift.
Oh, right.
And her, not, I don't know about, not
By the
a
way,
face,
on a
but
total
neck.
side note, I have information for you.
Okay.
Yeah. But yes, like some people will come in and ask for surgery, and I'm like, look, you're just not really ready for it yet. But facelift, neck lift is out there. But the non-surgical things that are similar, one that's almost identical in theory is Sculptra, which we do offer and I do like. So Sculptra uses the other suture type Vicryl, but it's a liquid form. It's
Okay.
not a suture. And so you mix up this liquid Vicryl and you inject it like you would inject filler.
Okay.
And it has that same collagen reaction formation. And people really like Sculptra. It's actually gotten a lot of,
Do you think it's better than filler?
it's different.
So it tightens instead
yes,
of fills. like
correct.
filler
Exactly
does.
right. That's
Okay.
exactly right. It is technically a filler type in that you're injecting it in, but it's not the volume of it that's changing the aesthetics. It's
Okay.
the fact that the product itself causes collagen formation and tightening. So it works a different way.
That sounds nice.
Yes, I do like Sculptra. In fact, my wife just did some, but you have to do a couple of treatments of it. So I'm really interested to see how that works out.
That sounds nice.
Yeah, I mean, I do
I
like
think I
Sculptra.
would, for some reason, I don't like the thought of my face being fuller. That's why I don't like filler. Like, I don't
You
like.
don't need filler, but you might as you get older. I mean, because you kind of have a round face anyway.
Yeah.
And in a nice way. You look very nice.
What? I'm just kidding.
But like you don't have like a thin gaunt face. Like you have nice full cheeks, and so
Okay.
yes, you absolutely do not need filler.
Yeah.
Now, as you age and your cheeks start to hollow,
Okay.
you may change your mind. I mean, around how old are
And
you?
then I can
35?
just say I had buccal fat removal.
No, don't do that. How old are you? 35?
Yes.
Yeah. I mean, 10 years, maybe. I mean, it just depends. Just people don't need it, you know.
Yeah.
But like in your 40s, it's common for the mid-face to start to hollow, and that's where filler I think is useful. Also, if you get the nasolabial folds, it's kind of helpful. So I do think filler's okay. It's just you don't want to overdo it. Like we've seen a million, celebrities that overdo it.
Yes, we
So,
have.
What was I talking about?
Sculptra.
Sculptra,
And your wife
right?
has it
Sculptra,
now.
yeah, Sculptra. So I think Sculptra's good, and then of course the other skin treatments like Morpheus 8 is great for tightening skin,
Laser.
and then the laser. Yeah, I mean I keep talking about those because I literally use them
Morpheus
myself.
8 is like needle.
Yeah, microneedling.
Things, okay.
Yeah, Morpheus 8 and Halo are fantastic for tightening skin. I literally use it every single year, as does my wife and most of the girls in the office. Because the risks are like insanely low.
You've told me to use it or try it.
You might try it. I mean, you're
I've
still
tried
pretty young.
Something at your office that has to do with it. I think it was Halo.
You did a Halo?
No, you asked
Oh.
me to, or said that I could, or
Oh
something
yeah, if you
like
want to.
that.
Yeah, sure.
But no, I've.
I mean, you're a
never-
little young for it. It will make your skin brighter. It'll like shrink your pores and all that. So like, even though you don't need face tightening.
Are there different levels of it?
Yeah, of course. Like
Cool.
when I do it to me, it's like turn that baby to 11.
Yeah.
Right? Because I
Yeah.
want like a really deep treatment. But for people like you do a lighter treatment for sure.
Oh, cool.
Yeah. So the bottom line, I'm not a fan of threading. I wouldn't recommend. I mean, I think if you go do it, it's not crazy, but I think that there's risks associated with it. For
What
like
would be like your perfect patient for that?
I mean, I just wouldn't.
Not in Mexico.
Well, yeah, definitely don't do it out of the country. But
Maybe like.
I feel like Brennan's about to say something.
We have a question in the comments.
Okay.
Okay.
Oh, bring it. What are they? Who is it? Is somebody?
Robert,
Okay, Rob. Yeah.
Dressel?
Yeah. What's up, Dressel? What's up?
he says, "What laser should I use?"
So I think that kind of depends on age. I know how old you are, Robert. So I would recommend Halo for you. But for somebody like Sarah, I might recommend either a really light Halo treatment or Moxie is nice.
Okay.
Because the older you are, the more energy you want. Because you're wanting to correct more things. So like somebody that's like 75 might use like a TRL laser, which is the step above Halo, which I kind of want that laser, but we haven't kind of pulled the trigger on it. That thing is a miracle worker. I mean, it's like a magic wand. But the
Cool.
thing is, it's like a 30-day downtime. Like it literally blasts your face, but the results are
Does
amazing.
it hurt?
Well, you have to numb up for it. Yeah, yes, you couldn't tolerate it without the numbing. Yeah, like no, it's for real. Like you have to numb up for the Halo, but it's like a
Yeah.
topical numbing. For TRL, it's like actual injections.
Dang.
But man, that thing works wonders. But yeah, the laser you want to use kind of depends on your age, and if you're younger, you definitely want to use a little bit lower power one. Like my age, you want to kind of want to get in there and use like something that's going to make a difference if you're going to do it. Yeah.
Yeah.
He said, I need a lot of corrections.
Come by, dude. You can do the laser at my place for free, man. Just come by. Just call me. Okay, let me recap this real quick. So, today we were talking about PDO thread lifts, which is where you actually take a type of suture that has barbs, put it into the face, and then pull it tight to get a facelift. They call this the non-surgical facelift at some places. And that pull of it actually tightens your face, and then the actual suture itself, as it dissolves, causes collagen formation. So this thing is used in a lot of places for face tightening. However, we're talking about a patient that I was consulted on that went to Mexico to get face threading, and now her face is infected, and potentially this is could be a disaster depending on if the antibiotics is cleared or not. So we're talking about this face threading. Interestingly enough, very few plastic surgeons have face threading offered in their offices, and I'm one of those that does not. I think the results from it can be okay. There's definitely other treatments that I like better, such as things like Sculptra, Morpheus 8, Halo lasers can do the same thing, but without the specific risk of face threading, which is the threads getting infected. Because if those barbed sutures get infected and they have to be removed, it totally sucks. It's like grappling hooks in your tissue, and they have to literally be cut out. And that's just not good for anyone. So I actually am not a fan of face threads. I personally wouldn't do it, and I would not recommend people do it. Sorry if you do face threads where you're at, but that's just kind of my opinion on it. So, all right, Brenda,
Yes.
you made it through your first episode.
I did.
How do you feel?
I feel great. This was fun.
You feel good? Okay,
Yes.
good. All right. Well, we're glad you're here. Thanks for doing a good job. We appreciate it.
Thank you. Me
Yeah,
too.
I think she learned a lot of different
Yeah,
stuff,
you're about to
honestly.
it's like a fire hose of information around here. So get ready. You can start taking notes.
I will.
Okay. All right. I think that's about all the time we have on today's episode of Nip Talk. Please leave us a comment. Let us know what you want us to talk about on the next episode, and we will see you next week.
Bye.
All right, just want to roll into the next one?
Yeah.